Health Department director
Numbers as
there,
normal,
getting
and
ready
then
to give us a
a
daily
couple of
briefing.
other
Let's
things
listen
to
in.
include the governor's announcement that just happened in regards to what they're titling the Badger Bounce Back Plan. So I'll give a couple of highlights from that. And then we are delighted to again have Sarah Johnson on today from the Y to give us some really good mental health tips to help keep us healthy in all ways as we continue working together to move into a different phase of this COVID-19 emergency. So to start with, the case counts in La Crosse County are very positive. We remain at the 26 cases. I think it has been a little over a week now since our last positive case. And we have the one individual who was hospitalized has now been released from the hospital and is recovering at home. So we have a total that are of 23 that are recovered, and then those other 3 that continue to recover. So of the percentage, then we have a total of 1,538 negative tests in our county, and that is a percentage of 1.7 of all the tests that are positive. So that is a wonderful percentage. Please remember, though, that case counts are only part of the story, and we do expect cases to increase. We are going to be working towards an increased amount of testing. And in fact, I'm having an important conversation after this media briefing with our healthcare partners to discuss just that. Where are we currently with testing in our county? Where do we need to be? And what is the gap? And how do we get there? So we are going to be increasing testing even starting this week. So we expect that we will see more cases coming in. On the state side, we have 4,499 cases positive. That is an increase of 153 from yesterday. And then negative case totals are 46,603. That is an increase of 1,280 from yesterday. And the percentage of positive to total cases is 8.8%. So that has stayed fairly consistent for the state. The hospitalized numbers are 1,211 individuals. And that is an increase of 21 individuals from yesterday. It's about 27% of the cases are requiring hospitalization. And the death total in our state is currently at 230 individuals that we have lost to COVID-19. And that is an increase of 10 from yesterday. So just a reminder that the cases that we report are always only lab confirmed cases. And we do know from some of our residents responding to Facebook posts brought us into understanding that there has been a Wikipedia post that had indicated 212 cases. So just know that that is not an accurate statement and that we are at 26 positive cases in our county. And we will always do our very best to be transparent. If you haven't heard me say it before, that is one of my very important values in leading the health department, is to be as transparent as we possibly can. I think that is the one and only way that we will have trust with our health department to be able to best serve our community residents. So a couple of reminders before I move into the Badger Bounce Back Plan. Just some reminders that we've had some questions about outdoor areas and how to engage safely when outdoors. So for example, if you are on a walking trail or you're on a sidewalk and someone jogs or runs or walks past you and they don't have a mask on, we've had the question, do we need to be concerned? And the answer is no, we do not. We do recommend that when you're out and about in, where you might have any contact with other individuals, that you wear a face covering. But you do still need to remember that with this virus, it is within 6 feet or more, and it's for an extended period. So it's not if you're just passing by. Even if somebody happens to cough as they're passing by, the likelihood that you would develop COVID-19 is very low. So I do think it's helpful to understand that it's really when you're out and about and you might stop and talk to someone, that would be not advised during this time unless you have a face covering on, and even still, it should be very short. We recommend against that. And that leads me into my second update, which is to remind folks about congregating with those outside your household. So I'll just use myself as an example, understanding that golf courses are now going to be opening. My son loves to golf and my father loves to golf, and I've already told them that They cannot go together while we're in the safer at home order, because we cannot be with others outside of our household. So, just remembering that we should not be interacting and engaging with those outside of our household at this time. And this is really all hard to take in. I understand that, but it is to protect all of us from this virus. And it's also hard to remember how dangerous this virus can be when in our own county we have not had any deaths, and we have really had very low case numbers. I'll just bring us back to understanding that there's 2 points really. One, that we are not broadly testing yet, and we will begin to open up testing criteria in the coming weeks. And two, that we really have low case numbers predominantly because we restricted travel and took a lot of action early on before La Crosse County had a lot of cases and had a lot of infections, such that folks that might have been infected were transmitting to others. So just recognizing that prevention is not always easily seen and understood, but I can assure you that there are reasons why we have low cases, and that if we allow travel to open back up, we would be at great risk, I believe, of increasing cases in large numbers. So just reminders for you. One really positive thing to share with you, well, a couple positive things. First of all, as we've heard from our residents on Facebook and in other means, even with the tough news of getting the safer at home order extension that happens on Friday, I think that predominantly our citizens and residents have been really supportive and positive towards each other and to us and other responding agencies. And we're really so grateful to see that. I think that says a lot about who we are in La Crosse County. And it just makes me so proud to work for you and serve you, because so many of us really get it. And the numbers that really struggle with the news or even are negative about it are really small. So just remembering that all of you make this work well, and I thank you for that. A really positive thing is that our first food drive event happened on Friday as well. And I'm happy to report that that drive brought in nearly 16,000 pounds of food for those in need in our community. And we're so grateful for that, because many of the normal food donation drives are not able to happen during this time with COVID-19. In addition, you may recall that there was someone in our community who wanted to remain anonymous, who donated $25,000 to match any donations that came in. And I understand that on one day alone, in 2 hours, our community brought in $19,000 that will be matched by that anonymous donor. That is just amazing. So I celebrate all of you who participated in that, or who are planning to participate in Food Drive Fridays in the future. A couple of quick notes about the Badger Bounce Back Plan, and then I'm going to turn it over to our guest, Sarah Johnson. So this just came out from the governor's office within the last hour and a half. What I think is important to note here is that the state is identifying phases in which we will be moving forward to reopen our state. And I think it's important to know what we're heading towards. I think it helps us all have hope and understanding about what the goal is and what we have to do to get to the reopening of our state. So first and foremost, recognizing we are in the safe at home order, and come Friday, we will be in the safer at home order, which is the extension to the safe at home order. Those are emergency orders number 12 and 28, respectively. Once we are through that order, again, assuming that nothing changes, phase 1 is outlined as having mass gatherings of up to 10 people, restaurants opening with social distancing requirements, removal of certain restrictions, including retail restrictions for essential businesses and operations, and some other items. So we're hoping that everything that we do in this next safer at home order up until May 26th makes it very clear that we're ready to move into phase 1. If not, we're really pushing to do that as soon as we can. So know that there are additional outlines of phases with phase 2 and phase 3 with other criteria that you can look up in the order online. And we will post, I think we already have posted some connections to this on our Facebook page. So then the order goes into progression through the phases and talks specifically about how we will move from one phase to the next. And this is not something that you can designate by dates. This is something that is designated by the components that have to be in place. So they call them core responsibilities, and one is testing, two is tracing, and the tracing is the contact tracing that we've talked about, that predominantly the health department, but other community partners like healthcare systems and businesses help with that as well. That's to make sure that anyone who's diagnosed or positive, lab confirmed for COVID-19, that we recognize and understand anyone who might have been in contact with them, and we follow up with them as well. That's contact tracing. Third is tracking. So that's really looking at understanding the spread and using data to understand that. Fourth is personal protective equipment, to make sure that we have enough for our healthcare partners and public safety agencies. And fifth is healthcare capacity, so that if at any point we have a wave that results in a lot more individuals needing healthcare services than typical, which we call medical surge, that healthcare systems are prepared and able to handle that surge. So those are the 5 components, and we're going to be heavily focusing in our community on testing. So immediately following this meeting, we're going to have conversations with our healthcare partners about, just as I said before, where are we at right now with tests? Where do we want to be? By when? Who are we going to be testing when we open that up? I want you to hear from me that we don't anticipate opening it up widely to be able to test anyone who wants to test. We're just not going to be able to get there in the next few weeks. We're going to need to be increasing testing, but we're going to need to do it in a careful way. So, for example, making sure that we're testing individuals that are in congregate settings, for example, where spread could really happen quickly. That might be long-term care facilities, or it might be other entities, even in like potential outbreak scenarios at businesses, things like that. So we're going to be working on the details, particularly with regards to testing. So I'll stop there for some of the details with regards to the order, but know that all of the details are there, and we will post information as we learn more about it. And at this point, I would like to thank Sarah Johnson for being on with us again today, and just tell you that I myself look forward to all of our mental health and wellness tips that we get from you, Sarah. So it's your turn. Take it away.
Thank you, Jen. I appreciate the information, and thanks for allowing me to be here too. Hi, everybody. So for those of you who don't know me, I'm Sarah Johnson, the Mental Health Director for the La Crosse Area Family YMCA. And my role is really to bring information, experience, and skills to you all through my training as both a prevention specialist, somebody doing health promotion, and somebody who has experience as a clinician as an outpatient counselor. So I'm here to help sprinkle some of that information in your brains. Mental health, as I've said before, is simply how we think, how we feel, and how we act. How we think, how we feel, and how we act. In other words, we all have mental health because we're all thinking, we're all feeling, we're all acting and making choices and behaving, doing things all the time. That's what it means to be a human. Certainly, we know that all of our behavior has been changed right now with our current conditions. And the way we act, our behavior, has an impact on how we think and how we feel. And as we think about having this extension with our safe at home orders, that can be something that can be really disappointing and really confusing and really difficult for us to take in. And that's just one of many disappointments that many of us have felt over the last month or so. And so I want to just acknowledge that everybody's disappointed right now. Everyone's frustrated right now. Everyone's to some degree scared or nervous right now. And all of that is really normal and natural given our current crisis. And that necessitates us really, I would say, doubling down, tripling down, quadrupling down on how we are caring for ourselves and how we're caring for others. So on an average day, it's really important that we do all of the things that help us feel good and like the best version of ourselves. And knowing we're not living in an average day right now, we have lots of extra stress. It's going to be that much more important that we take care of ourselves. So I'd like to start sharing with you some skills that can help us in managing some of this uncertainty and some of these big, strong, intense emotions that we might be having as a result of our new circumstances and as a result of some of the changes and challenges that we're experiencing in our everyday lives right now. First of all, I want to think about how important it is to what I call tune in. So notice what's going on inside. How am I feeling? What are my thoughts like? What are the physical sensations that I'm experiencing? To name those experiences, what are the sensations I'm feeling? Is this hunger? If so, what does that mean? It means I need to eat something, right? Is there fear inside? If so, what does that mean? It means I need to do some things to calm my system and determine, am I in a dangerous situation or not? So the naming is really important. And beyond just tuning in and naming how we're feeling, also expressing how we're feeling. So how do we let those feelings out? And how do we share those feelings with other people? I want to share with you a really simple way to think about this, which, spoiler alert, you're maybe already doing this in your day-to-day life, or maybe already have some experience with this. So you might be better at this than you really realize, and you can tune into that skill that you already have. Now, if you haven't done this before, if this is kind of new or kind of uncomfortable to you, that's okay. That's what happens when we try something new. And the good news is the more we practice a skill, the better we get at it. So I call this skill the how are you skill. How are you? So if mental health is how we think, feel, and act, when I ask you genuinely and really want to know, how are you? I'm asking you about your mental health. So the skill here is to genuinely ask someone how they are and then allow them to answer honestly. Now, in the Midwest, oftentimes when people say, how are you? We say things like, good, busy, fine, which is not necessarily an emotion, but B, a reflection of how we're really doing. So I want to share with you my screen. I'm going to show you a graphic here that shows you some emotion words. So you see across, we have fearful, angry, curious, happy, confident, sad, and then we have lots of others going around here to different degrees. I want to role model for you. If you were to ask me how I am, those are some emotions I can choose from, but there's lots and lots of emotions that don't fit on that little graphic. So let me tune in and pretend like you just asked me how I am. And I'm going to believe that you meant it. And I'm going to say, how am I feeling? I am feeling mildly anxious. I'm feeling curious about how we are going to maneuver through this very outstanding time, exceptional time that we're living in. I'm feeling connected to people I love who are texting me and sending me messages and calling me on the phone and FaceTiming me. And I'm feeling worried for people in our community who are not connecting or who are really facing some hardships. So you notice I'm feeling a lot of things, which is why I am spending more time on the trails. I'm spending time doing yoga in the morning. I'm spending time reaching out and being honest with my friends and my family about how I'm feeling. I'm not sugarcoating it, not worrying about worrying them, because I know that I'm letting them know I may feel some things that are unpleasant right now, like a lot of people, and I'm doing things to help manage that. And I know that if things feel unmanageable, I need to reach out for help, and I can reach out for help, and there's lots of help out there. I am suggesting that skill of, number one, asking other people how you are and meaning it, and number two, role modeling, identifying your emotions, like tuning in, labeling and naming how you're feeling, and then sharing it with others. Those are skills that you can use around your dinner table tonight. Those are skills you can use across the parking lot when you talk to somebody who's many feet away from you. Those are skills you can even use as you cross someone on the trail. And every time you use those skills, you're strengthening your own resilience, and you're strengthening the resilience of the person you're sharing with. Resilience is our ability to get through difficult times and grow because of those difficult times. So the way we do that is that daily practice of tuning in, naming how we're feeling, sharing and expressing that. I know I only have just a little bit more time, so I just want to share one more thing along with the lines of this skill. So if you were to practice this skill tonight around the dinner table and really mean it, ask each person how you are, I'm going to encourage you to leave room for people to answer how they answer. And so if somebody says fine, you can say, is there more there than just fine, or can you explain what fine means? And if they don't want to answer, that's okay. Let it be. And if somebody says, I feel terrible, I feel anxious, I feel scared, I feel pissed, I feel all the things that they feel that are those difficult emotions, instead of trying to argue them into feeling great, which might not be very reasonable, to just allow them to feel how they feel. And saying something like, this is really hard, which is true, this is really hard. Or, can I give you a suggestion? Or do you know what you need to be able to handle how you're feeling right now? And if they are open to a suggestion, a great suggestion to start with is just to take a nice deep breath in and out like this. And that deep breath doesn't fix anything, but it helps us slow down, helps our brain and our body just really get a little more grounded so we can be more thoughtful about how we respond to how we're feeling and the world around us. It doesn't fix anything, but it does help us really bring that level of anxiety down. With every deep breath, it can help us bring it down more. Now, if you are doing all the things right and you are still not feeling like you are able to get through your days, I really want to encourage you to reach out for help. And so for 24-hour help, there are several different options. I'm just going to give you a couple. One is calling 211 simply by picking up your phone and dialing 211. Any time of the day or night, you'll get somebody who is professional and trained to help support you, give you ideas about resources, or help you figure out how to get through a crisis. You can also call the Disaster Distress Hotline at 800-985-5990. One other resource, in case you prefer to text, a 24-hour resource to text would be texting the word help to 741-741. Help to 741-741. I just learned how to send you love, and so I'm doing that. Thank you, Colleen, for teaching me how to send out love. Please keep a steady head, an open heart, be safe, and be well.
Wow, thank you. Thank you so much, Sarah. I wrote all of that down, and I intend to try that tonight at my table. I have every belief that my kids are going to be a lot better at naming their own emotions than I am even. So we'll let you know how that goes. Maybe we can even have a little Facebook challenge about that. So
yeah,
skill. I think that is great. We do often hear, how are you? And we say fine. So I think we could be a little bit deeper, especially now, to make sure that those connections that we have and the loved ones that care about us, that we were really getting that encouragement that we need. So thanks, Sarah.
Yeah. And Jen, I would say that sometimes, especially as adults, we feel like we can't really share, like we have to fake it for other adults. And a lot of times we feel like we need to fake it for kids. And I'm arguing that we don't need to fake it. I'm not saying share every fear that you have with a child, because that could be overwhelming. But being able to be honest and saying, yeah, this is a scary time, and I feel stressed too, which is why I'm using these coping skills, is really helping teach them how to identify their emotions, and that it's important, and that we are able to use coping skills to manage those emotions.
Okay, I'm writing more down. Okay, I got it. All right. Thank you, Sarah, so much. All right, I think that's it for what content we had to share with you. So we'll now open it up for questions.
Hi, Jen. Justin from WKBT. Earlier you talked about kind of, you expect probably there's going to be a little bit more of a rise in cases coming up here. At the moment, do you feel as though with kind of all of the safer at home order and all the stuff that you've all done to more or less kind of stop the spread of it, do you feel as though the curve is somewhat flattened at this point in time?
Yeah, so we've heard this a lot. This, it's funny because we talk about flattening the curve in public health, and it's become this like widespread image of flattening the curve. So when people say to me, "Do you think we've flattened the curve here in La Crosse County?" I say, well, if we were testing more broadly and we still had this case number and we were not getting additional cases, yes, I would say we have flattened the curve. I also like the analogy of, because Denzel Washington is one of my favorite actors, and he has the movie Unstoppable, and it's about a runaway train. And I heard this analogy. If you're on a runaway train, when you know at the end of it, you don't want to be on the train at the end, but you also don't want to jump off when it's moving too quickly. It's about figuring out where that balance is, where it's going slow enough that you can jump off safely, but it's not going, it's not to the end of the track. Because that's obviously a danger as well. So I think, that's what's tough about this, is that balance, and trying to help our community members understand what the fact that we haven't had any additional cases for 9 or 10 days now, what that really means to us. So, we think that's a wonderful sign, but we also know that we're going to be increasing testing more broadly as weeks go by. And so we do expect to see those cases increase. Don't be alarmed if that happens. I think we're in a very good spot, as I've mentioned before, predominantly because of not the work we're doing, but the work that all of our community partners and residents, those that live here and work here, are doing, because it's tough work to have to be sitting in your own homes with a war against a virus on your doorstep. In any other war, we don't often have that sitting on our front door. So I think it's really in front of everyone in a way that we don't often, we just don't see. So I just want to express my gratitude to everyone in our community, because that is a great reason as to why we continue to have the low case number that we have, in addition to some of the safer at home rules that we've been under, predominantly because we're not traveling as much as we might have been, particularly to even other areas of our state that have a lot more cases. So hopefully that answers your question, Justin.
This is Caitlin with Wisdom. We had a listener call in with a question, wondering if there's an update on campgrounds, saying that there's some essential workers who might like to live in campgrounds instead of risking their own individual households.
Yeah, thank you, Caitlin, for that question. The question is about an update on campgrounds, and we are currently working on some language to adjust the health order that's in place for the campgrounds. I think it will be well received in the community, and we're just getting the final checks on that. So hopefully you'll hear more from us on that topic in the media briefing on Wednesday. So more to come, and I think it will be received well by our community.
WKBT again, Jen. Kind of going off what we talked about earlier, I know that you had mentioned that part of the reason why we've been doing so well is because of the fact that we just haven't been traveling that much. I guess, is there any particular risk with Winona having such a large surge in their community? And I don't mean to throw them under the bus, but I know some people like to, either commute back and forth for work or just have a family member and whatnot, or possibly live in the area. I guess, can you speak on that a little bit?
Yeah, so I think looking at the question is really about, what with the surge in cases in other counties around us, like Winona, for example, and, Alameda County is a small county that's had a number of cases. We're actually connecting regionally, including in the tri-state area with other health officers and health departments. So we've got a meeting coming up where Winona will share more details with us about what's happened there. But what we do know is that they had an outbreak happening at a long-term care facility, and they couldn't figure out where the spread was happening. And so because of that, at the time they had case numbers in the 20s, and they decided to test a number of individuals. And I don't know if they were employees or residents at the long-term care facility, but they found a number of positive lab confirmed cases in individuals that didn't have symptoms. So that is something we're worried about, and we don't have a good picture for. And so that was what caused their jump in cases in the 20s to go up to, by 20 something cases, is because of that testing of individuals to try to figure out where that outbreak was coming from.
Hi, this is Olivia with the La Crosse Tribune. There has been some talk about wanting to reopen Western Wisconsin sooner than the rest of the state. What are your thoughts on that?
Yeah, so the question is about opening Western Wisconsin in a different timeline than the rest of the state. So I have some mixed thoughts on that. I really don't think that, so on one hand, I don't think that our state is, it's not the same everywhere in our state. And I think we have had lower cases in the Western region, again, predominantly because of two things. One, the safer at home order, the timing of when that came into play for our Western region meant that we weren't exposing ourselves to folks from other parts of the state or other states and areas where the spread is much higher. We already, even coming into that time period, had a lot of people who had traveled that we had to make sure were staying home. And that's the second piece, is that folks were doing what we asked them to do. And in doing that, we reduced the spread in our communities. I also have concerns, though, that if we opened up, if reopening means allowing people to travel, then I would be concerned about that, because that means we could go anywhere where there is spread, and we're then really relying on everyone to make the right choice in terms of where they travel. And I think that's really tough for people, because we can justify reasons why we would want to go to a hot spot, for example. So I'm concerned about that aspect, though I think that we do have to have a balanced approach. And I can tell you that I have been in contact with our governor's office, with our Division of Public Health at the Department of Health Services, with our local association or our statewide association for health officers, with other counties, including their health officers and health department members. So through all of those communications, I really think we need to work to have whatever can be a unified, balanced plan. At this point, I don't foresee that means the Western region would be able to open up more broadly than the state would. But if that does happen, I would just want to make sure that the travel was not part of that, because that concerns me greatly, that we'd be moving very freely, even thinking about, and I've mentioned this before, how closely we are connected with Winona, for example. We have lots of folks who live and work in both communities, might be traveling now because they're part of essential workforces, but many, many more people would be traveling. And we do have cases in our tri-state area that aren't necessarily in the Western region. So we just have to look at all of the data we have. And I think in the next week or two, we're going to have a lot more data to be able to look at and determine if that would be a good plan or not. So I think there's more to come.
WKBT again here. Earlier you brought up some information that was kind of released that might not have been very accurate. Just in case people look at this kind of information and think, well, this might not seem very great. Where can they go to find resources where they will get the real information and they will get accurate answers to some of their questions?
Yeah, thanks, Justin. So the question is really, where is the best place to go for the most up-to-date, accurate information? For La Crosse County, that's really our website, which is lacrossecounty.org/COVID-19. Or certainly on our Facebook page, we post our updates every day for case counts and other things. And we have a really strong social media team that is trying to connect with our residents and the questions that they have. For statewide information or national information, you really should be looking at the Department of Health Services website. That department's website has a lot more data on it now than it did even a couple of weeks ago. And it's by county. You can see how many tests have been done that are negative. You can see statewide data and trends. And then also, of course, the CDC website. There are also a couple other websites that we've been sharing on our Facebook page. For example, the Wisconsin Hospitals Association has data about hospitals. So there are a lot of good ones. And I would say start with our local Facebook page, our health department Facebook page, and our website.
Awesome. And Sarah, this question is directed at you. Even in some of these times, people are a little bit more reluctant to reach out, especially for help. I know I have a lot of that in my family as well. I guess, what would you say to those people who are reluctant about kind of asking for help, and why they should at this time, especially this time when, a lot of people are going through the same kind of issues. A lot of people are going through a lot of that negative kind of impact on their home life.
Justin, that's such a great question. I'm really glad you asked that. I think you're right. A lot of folks are really reluctant to ask for help. And some of that is, in the United States, we really pride ourselves on being independent and being able to pull ourselves up by our bootstraps and do it all by ourselves. And that's not very realistic most of the time, quite honestly, but especially when we're experiencing extra challenges like we are now. So one is really giving yourself permission to do something you haven't done before, or to do something that maybe feels uncomfortable. And knowing that even though it feels uncomfortable to ask for help, it's a really healthy thing to do. And if you think about it, so I know that one of the things that's helping me get through all of this stress is reaching out and helping other people and being able to be a part of something like this briefing, right? To be able to provide information that can be helpful makes me feel good. Now, I know that my friends and my cat like to help too. And so if I know that it helps me and I know that it helps my friends to be able to provide help, then a way I can help my friends is by leaning on them and asking for help when I need it. The same is going to be true for everybody else's friends too. Everybody likes to be helpful, especially to the people they love. Now, there's also additional professional help that I've told you about. Those people do that work because it's meaningful for them to help their community. So you are not putting anyone out by asking for help, whether it's a friend or a neighbor or somebody on a professional hotline or somebody at the county who can help you get connected with resources. So important to ask for help, even if it feels uncomfortable. Right, Snazzy? He agrees.
I have some more for you all, but earlier you had brought up that 16K pounds of food that the community has kind of rounded up together. I guess, how many families will that go out to help, and what kind of impact will that have on some area families?
Justin, that's such a great question. I wish I knew the answer to that question about how many families might be helped by this almost 16,000 pounds of food collected in the food drive on Friday. We'll have to check on that and let you know, because I think the Hunger Task Force would be the better one to ask that question, but we'll find out and let you know.
Any other questions for Jen or Sarah? Okay.
Well, I thank you guys so much. Oh, Justin, did you have another one?
Yeah, sorry, I didn't realize I was still on here. I have two more, I promise. But earlier you brought up the testing and how you're going to talk with our healthcare systems in terms of trying to kind of open that up a little bit more. Would you say that we are pretty lucky to have a community that has two really awesome healthcare systems to provide that service for all of us?
Yeah, thanks, Justin. Our healthcare systems are some of the best in the world. We are really lucky, and they serve, like tons of counties, 21 counties, I think, is the Gunderson, and Mayo is probably similar or more. So we are really lucky. They are fantastic partners. They have a lot of intelligence and information to be able to share with all of us. We're really lucky to have those two healthcare systems right here in La Crosse County. And I think that if anybody can solve this issue for La Crosse County, working together between public health and healthcare, and then looping in businesses, we're going to get it done.
Awesome. And then, lastly, from my side, with this Badger bounce back plan, I guess, is this kind of more or less kind of a nice positive kind of look at kind of our future and seeing kind of the light at the end of the tunnel, will you, with all these different phases and trying to get businesses back up to at least some sort of normalcy right now?
Yeah, so I think, Justin, the Badger Bounce Back Plan, in my opinion, we needed to have some understanding as a county, as a state, of where we're heading. And to just be told that we need to move into the safer at home order. And we didn't, many people felt like they didn't understand why that decision was made, how it was made, based upon what. So I think it's important for all of us to know where we're going and where we're heading and what we need to do to get there. So I think having that plan released, and more details are needed and will be coming, but having that to start with is really important for all of us to be able to get ourselves ready for the reopening phases. And we want to be fully ready to do that.
I'm not seeing any other questions, Jen.
Okay, well, I'm going to close it out by just reminding you all that we are fighting against a virus. We are not fighting against each other. So we are humans and we need each other. And Sarah's sending us all love, and I'm grateful for you. So express some gratitude within your own families if you can. And remember that we're all in this together. So thank you for being here with us today. And we look forward to seeing you on Wednesday.
Okay, and that wraps up another press conference from the La Crosse County Health Department. These briefings now happening on Monday, Wednesday, and Fridays online, as you can see, to fall in line with social distancing guidelines. Some good numbers to report here. Health Department Director Jen Rombalski saying that there are no new confirmed cases of COVID-19 in La Crosse County. That makes it now a 10-day streak since the last confirmed COVID-19 case was announced. That was back on the 10th of April. So it's been 10 days now without a confirmed case. She also told us that the person who had been in the hospital has since been released. So the case count remains at 26 in La Crosse County. A majority of those people have since recovered from the virus. We will have much more for you coming up tonight on Live at 5, including details about the governor's planned Badger bounce back that you also heard the health department director talk about there. So please tune in tonight on Live at 5. For now, we'll return you to normal programming.